This tutorial will show you standard operations and options. This app is called the House DNA Robot, or HouseDR for short, version 7.26. This tutorial will also review some of the general anatomy of the House DNA Robot. This tutorial will show some special operations. Essentially, there are two screens, the main appointment page and the routing template page. The routing template page will be examined in a moment. Just press here on the patient's name and map will take you to the routing template page. The main appointment page, or map screen, has an upper part and a lower part. The upper part is the appointment book. This is essentially the screen that the clinical staff will use throughout the day. The lower part is the part that the administrative and business staff would use to schedule and change patients' information. The lower part of the screen has the patient scheduling related fields to schedule an appointment and to list patients' information. Just touch the Schedule Appointment or Make Appointment button to open the scheduler part. The lower part of the screen will expand and patient scheduler selections and files are opened. To collapse or close the lower screen, just click here on the red X. This is the calendar, the timetable. This is the area that is populated with the patient information when setting an appointment. Let's go to the routing template page. Double-click on the patient's name or press here. A very important operation about the House DNA Robot is the ability to use a standard CPT database or to use in-house code letters to replace CPT code descriptions or complicated and long CPT code numbers. You can see how this template has used the in-house letters IOV to represent initial office visit. IOV also is representative of this code 99204. Various other codes can be used to represent a different level of CPT code numbers. The providers decide which code numbers they would like to use. You can see here, office visit 99213 is easily represented by the letters OV. A brief office visit, or 99212, is represented by the in-house letters OVB. Intermediate office visit 99214. The selection was OVI for office visit intermediate. Virtually any in-house letters can be used to be representative of the code numbers. Let's see how that works. We can enter in the code number and the predictive text box will generate the code number and code description. If we don't know the code number, we'll just use our in-house letters. The in-house letters for OV is representative of 99213 and the CPT code description office visit. We can select to use OVI for office visit intermediate. These are the in-house code letters that is designed by each provider and representative of the CPT code number 99214. For office visit minimal, you can enter in the code number. If you're not sure what the code number is, but you're sure of your in-house code letters, you would use your in-house code letters OVM for office visit minimal, and it is representative of the code number 99214. 211. Office visit brief, or the preview button allows you to review what you have created here on the worksheet or routing template. RTO is the return to office visit. ICD is for typical ICD diagnosis codes. They're listed generally in alphabetical order. The predictive box for ICD can be used as well by entering the first letters beginning the diagnosis. We see ABN pulls up abnormal gait, whereas ABR predictive text is more specific for abrasion of the ankle. As you increase your ICD or diagnosis data bank, this predictive text will work equally as well. This concludes our general description of the special operations of the House DNA robot.